Now let's move on to phase 3. So at this stage, you've had high blood pressure for a considerably longer time now, and this will potentially lead to real-world consequences. Firstly, coronary arteries can narrow, and this can lead to reduced myocardial perfusion, basically reduced blood flow going to your heart muscle. This can increase your risk of angina or even heart attacks. In the brain, small vessel disease can actually impair cognition and even lead to stroke. And the stiffened left ventricle we spoke about earlier, this may progress to diastolic heart failure. And remember the kidneys we spoke about earlier with the protein in the urine? Well, with time, they can reduce their filtration capacity. So this means that your serum creatinine rises and your eGFR will drop. eGFR is basically an indicator of how well your kidneys are working. And again, I have seen this in countless number of patients who don't want to accept they have high blood pressure, they feel completely fine, but they don't realize that internally, all these different phases are happening with time and all this damage is potentially happening as well. So now moving on to phase 4, I really want to talk about the advanced stages now. So damage becomes much harder and sometimes almost impossible to reverse now. So first of all, we have an increased risk of vascular dementia, and this can basically be from long-term cerebral microinfarcts. We might have developed end-stage renal disease, which might need you to actually have dialysis. We might have progressed into congestive heart failure now with a reduced ejection fraction, so the heart is not able to pump as effectively as it used to anymore. And we might have even got permanent vision loss from something called optic nerve ischemia. Now again, there's no guarantee any of these are going to happen to anyone watching this video, but these are the potential phases of what can happen with uncontrolled high blood pressure. It's really important that we're talking about it. So what I really want everyone to think about is that this journey, it doesn't need to end at these stages where if you've got high blood pressure, it's always a good idea to listen to your medical provider and what they're advising.